Brushing our pearly whites is such an ingrained part of our daily routine that we no longer think about it, and therein lies the problem. Mindlessly brushing away while thinking about work or school or what your sister's mother-in-law's brother told you about how to best stuff a chicken. I mean, that might not be doing your teeth any favors. And as with most things in life, technique is everything, which is why I've got Christine in studio today to help me with my technique. Christine, welcome.
Welcome.
We've got some amazing tools over here.
Yes.
I mean, where do I start?
Okay.
I just have a toothbrush at home and a little bit of floss.
Okay, so what happens is everybody wakes up in the morning and we've all got to brush our teeth, okay?
I would hope so, yes.
Yes, and then what happens is we can take our tongues and we can feel the plaque on our teeth, and that feels bumpy and furry. Plaque is bacteria in our mouth, the food we eat, and our saliva.
Okay.
So what happens is the bacteria eat the food, they drink your saliva, what comes out of their body is actually plaque.
Oh,
And-
wow, okay, so that makes me want to brush my teeth all the time, really?
Exactly, yes, and that feels bumpy and furry.
Okay.
And that's what you want to try and get rid of. So how we're going to brush is we're going to brush in a circular motion.
Okay.
And brush in about 10 seconds every 2 or 3 teeth. That this outer section here should take you about 30 to 40 seconds. And we're going to brush on the inside there by the tongue all the way around another 30-40 seconds. The only time you're allowed to brush in this way is on top. You never brush like this on the side.
That's interesting.
Because if you brush like this on the side, the gum starts to recede, and that causes tooth sensitivity.
Wow. So tell me about floss then. I mean, isn't there
Yes.
some easy technique that
Yes.
I get knotted and I stop the blood in my fingers when it just becomes a bit of an awkward.
Well, as you can see, I wrap it around my middle finger.
Middle fingers. Okay.
Correct. And then I play with my index and my thumb.
That's
And as you go in between each area, you unwind it, because you don't want to let that area that you've stuck in there between the teeth that's contaminated with
Sure.
plaque.
Contaminate the next tooth.
Exactly. So you want to limit that. And that obviously you go in between each and every single tooth. If you don't like flossing, there are other things that you can use, like little interdental brushes. And you can speak to your dentist and your oral hygienist about these tiny little brushes. And that's what's nice about them, is they can just gently go in between the teeth like this.
Okay, and that's quite quick and easy.
Exactly. And what also works well are these new little things. A lot of people collect plaque on this surface here underneath the tongue.
Okay.
And you can always just sweep it up, that bumpiness and furriness, and clean up at the back there. Then what's important is also tongue brushing,
Yeah,
because
that's
your
right.
breath comes from your tongue. So if you imagine, my fingers are tongue, so you want to start in the front part of your tongue and clean it off with water. Then you want to go to the middle part of your tongue and clean it off. And then some people want to gag. So I always say to my patients, breathe through your nose, and then you won't feel like you want to throw up.
Now, are these an illustration of what plaque looks like, or is this actually some sort
No,
of...
these are new little toothbrush on the go. This is a bridge between chewing gum and your toothbrush. So what you would do on it, you would place it, and with your tongue and your lips and your cheek, you would actually roll this and move it up and down, causing the friction to remove that bumpiness and furriness. So there's many options, and it's all about friction.
Christine, thank you for that. Some really, really good advice about technique. And why is the proper technique so important anyway? Well, obviously getting rid of any leftover food, bacteria, and general nastiness in our mouth is important, but keeping teeth and gums healthy is just as important for your overall health. Poor oral hygiene has been linked to a number of conditions, from low birth weight babies to erectile dysfunction to diabetes. So there are definite benefits to keeping your pearly whites, well, pearly white. Benefits that go way beyond having a picture-perfect smile. I'm about to brush my teeth.
Need advice? Download